Well, a new report from the World Health Organization is highlighting tobacco's deadly impact. Smoking is still one of the leading causes of preventable deaths. That's according to World Health officials. In fact, tobacco use continues to be one of the biggest public health threats, with 8.7 million people dying from tobacco-related diseases every year. And joining me now is Dr. Judith Prochaska, professor of medicine at Stanford Health. So thank you for joining us. And starting off, just kind of break down, why is tobacco so deadly? What does it do to our bodies?
Thank you, Ryan. Yes, it's the smoke that's created when you burn a cigarette and inhale it. And smoke out in nature is something that animals avoid. You know, they run from forest fires. But the smoke from cigarettes, it carries over 70,000 different chemicals. 70 of those are either known or suspected to cause cancer in humans. And the other thing in the cigarette smoke is high levels of nicotine. And when nicotine is inhaled with smoke from a cigarette, it rapidly reaches the brain, and that creates addiction. So people become hooked on their cigarettes. And there's no other drug that's dosed as frequently as nicotine is with a cigarette. And with each puff, they're bringing those toxins deep into their body.
And when you talk about addiction, how addicting is nicotine?
It's extremely addicting. It's the hardest drug to quit, even harder than, say, heroin.
Wow. Okay, so 1.3 million non-smokers die every year from secondhand smoke. How are we seeing secondhand smoke impact people, and what are some ways to protect yourself?
Yes, so secondhand smoke is the smoke that's exhaled when someone is smoking a cigarette, or that comes off the end of the cigarette when the cigarette is burning. And secondhand smoke is harmful to those around the cigarette. It's the leading cause of sudden infant death syndrome. It also causes heart attacks and cancer in humans, as well as cancer in pets like dogs and cats. Ways that you can protect yourself is to encourage and support someone to quit smoking, and then also to support clean air laws. So getting cigarettes banned from places like beaches, music venues, all work sites, multi-unit housing, public housing, so that people have access to clean air.
And there's been a rise in young people using tobacco. We don't necessarily see cigarettes. Many of them are using those e-cigarettes. So what are some of the health problems that can come from this?
Yes, so e-cigarettes have been very popular among young people in this country. And what we see with that is great risk of nicotine addiction. So tobacco use is called a pediatric disease because most people who use tobacco as adults started as teenagers. And with teenagers, they tend to experiment, they tend to be more impulsive, to not appreciate long-term consequences. And the brain at this stage is very vulnerable to addiction. And so with vaping, we see nicotine addiction. In adolescence, we see worsening of asthma symptoms, decreased lung functioning, and possible effects on the heart as well.
Is there misconceptions that e-cigarettes are quote unquote safer?
If the comparison is to cigarettes, there are a few things that are as harmful, deadly as cigarettes. So cigarettes contribute to about deaths in half to 2/3 of people who use them long term. But cigarettes are not, e-cigarettes are not safe. So they are harmful. They do create addiction, and they can hurt the lungs.
All right. Well, always good information. So Dr. Judith Prochaska, thank you very much for joining us.